Hi there, my name is Middaugh and I'll be presenting on our on-demand service line today. I'm an LCSW by background and spent time as an ED director as well as working on inpatient psych settings before taking position as Director of Business Development with Array. Here in this position, I now lead up our hospital-based services and partnerships in the Great Lakes, Midwest, as well as Southeast regions of the country. Telepsychiatry first got started within hospitals. In particular, the emergency department and inpatient units had a huge need. And actually, video-based telepsychiatry has been around a lot longer than many people realize. For example, we've been doing this for over 21 years. And in fact, our founder and chief medical officer, Dr. Varel, was the first provider to complete an involuntary commitment decision using telehealth methods. In the ED setting, the focus is obviously on rapid access. What we do is we provide a crisis psychiatrist who's available to quickly work with the on-site staff, engage and evaluate the patient, contact collateral information, and coordinate next steps of care. Studies have actually shown that when an ED has a psychiatrist available, including via telehealth, there's improvements to metrics that benefit patient, staff, and even the hospital finances. Frequently, the greatest impact is seen in a reduction in behavioral health patient length of stay by up to 40%. And as I'm sure you all are aware, behavioral health patient length of stay is much longer usually than the average length of stay, oftentimes twice as long, if not more. Also, they saw a reduction in transfers out, which means all the work that goes with it, the calling and finding a bed, the transferring, the consultation, accepting doctor, and more. And also, most surprisingly to me, was a 50% decrease in patients that left against medical advice from the EDs that had telepsychiatry available. On the medical floor, the cases psychiatry tends to be working on are much more complex and get into the consult liaison type work where a hospitalist is working closely with a psychiatrist to evaluate the patient both from a medical as well as a psychiatric frame. From there, they can make decisions on patient's care and treatment. Oftentimes, video is involved with the patient, although sometimes these patients are too compromised or too complex for video to be much of a deciding factor. We often also see capacity decisions being made via this method. In addition, on-demand care has found applications within inpatient psychiatric units, from covering call to rounding on the weekends and assessing changes in status to determine next steps. The way we make sure that all of our partners have rapid access to psychiatrists is by bringing a panel of providers that are licensed in your state, as well as credentialed and privileged with your hospital. While we collaborate on a unique workflow for each of our hospital partners, most of the time things follow a pretty similar outline. First, the patient's identified as needing to be seen by one of our providers. An on-site staff member can enter a few pieces of demographic information on our secure portal. From here, our in-house access center team takes over and makes sure it's routed to the most appropriate clinician, taking into account response time, specialty, and more. After taking over the case, our physician will consult with an on-site staff member. This is often a crisis worker, charge nurse, or attending doctor. From there, the provider completes the evaluation, makes recommendations regarding level of care, medication, and next steps for the patient's care. After that, the provider will sign out with another identified staff member, oftentimes the same one as before, or in addition, the attending ED or hospitalist. Prior to moving on to the next evaluation, our providers are required to complete all required documentation in the EMR. This includes psychiatric evaluation, commitment forms if necessary, and other documentation as needed by our hospital partners. As a behavioral health practice first and foremost, we view technology as a means to an end, and that end is improving access at all levels of care. In particular, the hospital is desperate for support in their EDs and medical settings for patients who present with psychiatric needs due to a lack of services in outpatient communities and more. Due to our focus on this, we are one of the largest telepsychiatry providers in the nation with over 500 clinicians, and we've been doing this, as discussed earlier, for over 21 years. What that means is we view our partnerships seriously, and we keep them for a long time, and we bring this wealth of experience and scale to all of our partnerships to make sure we have an efficient and effective program. Thank you very much for your time. My name is Middaugh, and if you have any questions, want to talk shop, or just want me to share some of the studies I mentioned behind the data, feel free to reach out to me at my cell phone or email. I'm always happy to connect, and potentially maybe we can find a way to work together. Thanks again, and I hope you enjoy the rest of the conference.